Thank you so much, Chris. Good evening, everybody. I would like to acknowledge that I'm joining you this evening from the ancestral, traditional, and unceded territories of the Coast Salish people, in particular the Musqueam, Squamish, and Tsleil-Waututh nations. I'm grateful to the Indigenous people of Turtle Island who have care of this land since time immemorial. We stand with them in solidarity as we all mourn the loss of the 215 children found at the former Kamloops Residential School and the many more children that we are hearing about increasingly at the site of other former residential schools. As we celebrate World Refugee Day today, let us also recall that tomorrow is the National Indigenous Peoples Day and our responsibility in knowing the Truth and Reconciliation reports and its 94 calls to actions. S.U.C.E.S.S recognizes and acknowledges our community shares history of injustice and discriminations, and uphold that is our joint responsibility to actively work towards achieving healthy and inclusive communities and environments. Today, as we observe World Refugee Day, we can't help but consider the impact of the COVID-19 pandemic and the suspension of resettlement, along with stay-at-home orders and border shutdowns, and how this has impacted many refugees who have been forced to leave their home country to find safety. We also know that refugees who are recently resettled continue to experience post-arrival challenges that put them at great health risk. On March 17, 2020, the IOM, International Organizations of Migrations, and UNHCR, United Nations High Commissioners for Refugees, announced that due to the COVID-19 pandemic, any travel related to refugees resettlement would be suspended. That includes government-sponsored and privately sponsored refugees to Canada. The suspension of resettlement, along with stay-at-home orders and border shutdowns, have important ramifications for refugees. As a global leader in resettlement, Canada was set to bring in over 30,000 refugees in Canada last year. However, because of the pandemic, there were only 7,000 resettled last year. So what caused the low resettlement numbers? So part of it is due to IOM Canadian orientation about programs going virtual. Refugees not getting the exit permit in time due to COVID, health, and safety restrictions. Flight cancellations, longer journey, limited flight options, more transit flight before landing in Canada. COVID testing before boarding and also at the point of entry, and the mandatory 14-day self-quarantine. According to some of the statistics provided by S.U.C.E.S.S Community Airports Newcomers Network, CAN, between April 2020 and March 2021, 666 RAP clients arrived at the Vancouver International Airport, which is a reduction of 325% from the previous year. The majority of the RAP clients came from Syria, Somalia, Eritrea, Iraq, and Iran. The health policy and programs enacted by the federal and provincial government have significantly affected how society operates at both the individual and community levels. Similarly to other infectious diseases, COVID-19 impact the more vulnerable and marginalized populations disproportionately. Highlights the inequality in access to care and the importance of social determinant of health. Health insurance, health literacy, personal protective equipment and testing capacity, living conditions, and personal circumstances, work circumstances, and underlying medical and mental health conditions, and lower access to care, stigma, and perceived discriminations, closure of public spaces such as schools and libraries, closures of community and religious centers, and closures of borders all added to the compounding challenges faced by resettled refugees. At this time, much is unknown about how long COVID-19 will challenge the way we live our lives. Whether for this pandemic or the next global health emergency, understanding how to best support the most vulnerable needs continue to be a high priority. The pandemic isn't over yet, But as we are slowly returning to more of what life used to look like before all of this, it continues to be paramount to support refugee health during and post-pandemic. So what can community organizations, social service agencies do to support? Here are some of the things we do as S.U.C.C.E.S.S. Share COVID-19 information and resources and provide services that are culturally responsive and appropriate for community, work, school, and home setting. Verbal communications such as phone or video calls, communication via text messages are effective and preferred communication methods. Collaborate with local health authority to support health education efforts and to deliver key prevention messages. Work with refugees and explain what contact tracing is and what public health worker needs to find people and why public health worker needs to find people who have come into contact with someone who has COVID. Work with community health workers in refugees community to educate people about COVID-19, discuss strategy on how to safely isolate or quarantine within the household when needed, and refer refugees to free or low-cost services. Work with partners to connect refugees with the healthcare and community resources they need when they become sick and test positive for COVID. That includes medications, healthcare provider, and mental health services. In terms of facilitating refugees' access to COVID-19 vaccine, here are the things that we can do. Ensure availability of culturally and linguistically appropriate vaccination materials tailored for refugees populations. Share and disseminate culturally sensitive resources and materials about vaccinations. Develop partnership with community organizations such as local pharmacy, community center, housing units, and school to host vaccination clinic. Learn about individuals and community-level barriers to COVID-19 vaccinations, including limit access to vaccination information and cite understandable distrust of the systems based on historical experiences, challenges in navigating vaccination registrations, language barriers, work conflicts, cultural and religious belief, and misinformation about vaccine. And then work with partners and stakeholders and community to reduce vaccine hesitancy. And identify trust member of the refugees community to serve as a vaccine champion and proactively refer individual to relevant vaccination resources. Despite barrier faced by refugees resettled in Canada, they have the support of social service agency and community groups. The federal, provincial, and municipal government should continue collaborating with this group in the COVID-19 response effort. Let's continue to work together to put this pandemic behind us in a good way that takes into account the very important work of social justice that we are called to do from a trauma-informed, anti-oppressive lens. Even though someone might have had a refugee's experience, they are all, first of all, resilient because the bottom line is they are still here. And additionally, they have tremendous amount of skills, ability, and potential that can be supported, developed, and help them to get back on their feet. Thank you so much for your time. I look forward to the other panelists.
Thank you very much, Peggy.